the report?
Sir, we have a 65-year-old male with a history of diabetes and high blood pressure who has been short of breath over the last day. Per his wife, he's had a recent pneumonia and was just discharged from the hospital. We got a call because he was increasingly short of breath overnight. En route, he became hypoxic and bradycardic and then had a loss of pulse. He was in PEA the whole time. He's had 2 rounds of epinephrine so far, and he was intubated in the field.
Okay, team. So we're going to get a cardiac arrest patient. So Dr. Calrissian, I'm going to need you to take care of airway. And Dr. Gunnan, I'm going to need you to give good quality chest compression. And Nurse Coley, you're going to be taking care of IV drugs.
Sure.
Okay. All right. So Dr. Calrissian, so what's the airway status?
All right, I have a 7.5 tube. It's 23 at the lips. Let me take a listen, see if I can hear breath sounds. It's kind of hard to hear it on the left.
Mm-hmm.
Also a little bit hard to hear it on the right. I think I hear something in the stomach, but it's actually really hard to tell. I'm not sure if we're in or not.
Okay, let's just connect the end-tidal CO2 and see what the reading shows.
Yes, sir.
End-tidal CO2 is a useful piece of data to help guide resuscitation. This is what a typical waveform looks like. There is a Y and X axis, where the Y axis represents CO2 measured in millimeters of mercury, and the X axis represents time in seconds. This waveform essentially is a measurement of CO2 as it is exhaled. The first arrow is the beginning of expiration. The plateau is just essentially the expiratory time, and the second arrow denotes the end of expiration and beginning of inspiration. In a tracheal intubation, you should expect to see this step-like waveform. An esophageal intubation, however, does not produce any waveform as there is no CO2 to measure in the esophagus, and thus the monitor will show this just straight line. Misplaced ET tubes are a cause of cardiac arrest, and this device can detect up to 23% of unrecognized missed intubations. It is a Class 1 recommendation per AHA guidelines.
The tube is not in place. Can we just take that tube out and put a new one, Dr. Calrissian?
We can re-intubate the patient. Tube taken out. Nurse Coley, if you don't mind handing me the tube.
Here you go, sir.
Thank you. See epiglottis. I see cords. Oh, this is an easy one. Oh, this is good. Definitely in. We can attach our ambu bag. Easy intubation.
Alright, so what's the end-tidal CO2?
Do we actually need an end-tidal CO2? I'm pretty sure I got it. I saw cords.
He's got this.
This was an easy one, Doctor.
Dr. Calrissian, we need to use the end-tidal CO2 to confirm
Alright, let's see if
placement.
let's confirm tube placement.
Alright.
End-tidal CO2 being attached. We have a end-tidal CO2.
End-tidal CO2 is not just a measure of ventilation, but also of perfusion, as blood flow is needed for gas exchange. Since we've already confirmed adequate ventilation with placement of an ET tube, in the setting of an intubated coding patient, end-tidal CO2 is directly related to the cardiac output. And since CPR is essentially us artificially giving the patient cardiac output, it can be used to measure quality of CPR. High-quality CPR produces an end-tidal CO2 of greater than 10, as you can see here. But as you can also see, it abruptly drops to less than 10. This indicates compressor fatigue, and the compressor should be switched out.
In the trachea. Dr. Gunn, we need you to provide high-quality chest compressions, please.
But I'm tired. I'm so tired.
All right, then, Nurse Coley, can you take over, please?
Yeah, sure.
We still have an end-tidal CO2 of 10.
All right. Okay, much better chest compressions, Nurse Coley.
Thank you.
All right, so we can go ahead. Let's go ahead and see what the end-tidal CO2 shows. Okay, great. So is it time for pulse check right now?
We're at 2 minutes. We can do a pulse and rhythm.
All right, yeah. I think
we have an end-tidal of 40.
I feel a pulse.
I have a femoral pulse.
That's awesome.